morning all. Myself is Dr. Timmy Francis Chandy. I'm a postgraduate in Madurai Medical College. And it's a small study, it's a comparative study on RNFL ganglion cell complex thickness and optic nerve head morphology in early thyroid eye disease using STOC. Now, as we all know, thyroid eye disease is an autoimmune inflammatory orbital illness and is most frequently unilateral or causing unilateral or bilateral proptosis. Of these, 90% of them are caused by Graves' hyperthyroidism. And the presentation is typically occurring in the 4th to 5th decades. And we can assess this patient using thyroid function tests and the ocular signs available. Now, orbital inflammation and edema leads to increased retinal nerve fiber layer thickness in early stages. As we all know, the severity of thyroid eye disease shows a hyperbolic curve called the Randolph's curve, and it is an early this we can pick up using RNFL thickness, which is also an early indicator of disc edema. This usually follows axonal loss, thinning of RNFL and optic atrophy due to inflammation, which can be detected early using OCT, which is indeed a useful tool to assess optic nerve dysfunction at an early stage. Now, the purpose of the study. The purpose of the study is to compare the changes in RNFL, ganglion cell complex thickness, and optic nerve head morphology in early thyroid eye disease using spectral domain optical coherence tomography, and to analyze these parameters in early thyroid disease and its relation to severity of orbital disease, and therefore to establish these changes to detect early optic nerve dysfunction in early thyroid disease. Now, coming to the materials and methods. The study design employed was of a comparative cross-sectional study, and the duration of the study was 1 year. The sample size taken was 50, out of which 25 were cases and 25 controls. And the study setting was Department of Ophthalmology, Government Rajaji Hospital, Madurai. The study population included individuals more than 15 years with early thyroid disease and evaluated as exophthalmos less than 3 mm and high free T4, T3 and T4 values. Those on anti-thyroid drugs were excluded. Ethical and other informed consent were taken prior to the study. The retinal nerve fiber layer thickness, ganglion cell complex, and other optic nerve head morphology, such as disc area, cup disc ratio, were explored using OCT, which used spectral domain. And then the data collected were all collected and prepared as a master stat and assessed using SPSS 16 software. Now, coming to the results, as in any other previous studies, the mean age group was between 41 to 50 years, and of all the cases, active cases were only 44% and inactive were 56%. And about 68% were bilateral. Now, coming to the main point, that is the RNFL thickness showed an increase in cases compared to controls, whereas in active cases, there had been an increase, a significant increase, a statistically significant increase in active cases as well. In this 25 hyperthyroid cases with early thyroid eye disease evaluated were compared with 25 normal subjects, and the mean age group of the study was within the 4th to 5th decade of life with a female preponderance, which were all corroborative with other earlier studies. And of these, 32% of cases has history of cigarette smoking. Now, the retinal fiber layer thickness were measured in each quadrant using STOCT. As you all can see, the superior quadrant cases showed an increase by approximately 20 points, and inferior also showed an increase in number of in the cases in nasally and temporally, and the mean also showed more values on the case side. Now, coming to other parameters like the ganglion cell thickness, optic nerve morphology, they were less significant statistically, as these thickness among cases was 64.44 micrometers, whereas among controls it was 67.46, it was less significant. And there was no significant changes in disc area or cup area and cup disc ratio. So the only main parameter which showed some significant change was retinal fiber layer thickness. So to conclude, the RNFL thickness is increased in cases when compared to controls, and also in active cases when compared to inactive cases. This was attributed to the ongoing inflammation in retinal fiber layers in early stages of disease, and this can be used to pick up cases early.
Thank you, doctor. Nice presentation.
Hello.
Can you define how you define early thyroid eye disease? Do you use any validated scoring system?
Yes, ma'am. Clinical activity score. With that, we used exophthalmometer, exophthalmometer. We less than 3 mm proptosis we included in the study, ma'am. Then free T3, T4 values were assessed.
No,
and
to gauge the activity
severity
of
of
thyroid eye
disease.
disease,
Disease,
we have clinical activity score or a visa score. Did you use any of the
we used clinical activity score, ma'am,
clinical activity
to
score?
differentiate between active and inactive cases, ma'am.
Right. So
For more
what
than
was your
3.
definition of early thyroid eye disease? Till which point did you put the patients in early stage?
Ma'am, from the point of diagnosis to the point of treatment, ma'am.
No. So
How you are diagnosed early
early,
cases
what
of
is the
thyroid
definition
eye
of early in
disease?
your study?
Less than 3
Less
clinical
than 3?
points, ma'am.
So you have studied only hyperthyroid cases,
Yes.
not hypothyroid.
No, sir.
Why?
He's taking thyroid.
Now in a study only high values came, sir, with significant high signs, sir.
Okay.
Thank you.
Okay.
Thanks.
Thank you.